All right, so moving on to the concept of vaginal pH testing. We just, so everybody who knows what pH testing is, pH is basically you want to determine what the acidity, or the basicity of something, So basically, use something like what this pH test strips. To all my students who have been to the lab, you must have seen the strips. So there's a way you can actually still use this to check, for vaginal. All right. Of course, knowing the acidity or basicity of the vagina can help you, be able to now ascertain a lot of things. So the vaginal pH is just a simple way to access the acidity or basicity, or you say alkalinity of vaginal secretions. Now it helps to identify if there's a potential infection there, or if the hormone levels are not balanced, okay, and maybe the microorganisms that used to be in that vagina, maybe the good ones, the level of the good ones and the bad ones are not balanced. So the normal pH is ranging from 3.8 to 4.5. Do you understand? Which is moderately acidic. So anytime you see the numbers going up, it is going towards basic. So acidity helps to maintain a healthy environment. That means the bacteria that are normally in the vagina, they love acidic environments. Do you understand? So once you see the environment going basic, you know that okay, these bacteria are dying already. So what was the reason that you should check it? All right, what should make you go to the hospital that they should check for the pH of your vagina? If you're having unusual vaginal discharge, if you have itching or burning there, if there's a foul or fishy odor, that's what all those bacterial infections. If there's pain during urination or sex, if the pH is now going basic, all right. If you have bacterial vaginosis, that's bacterial infections of the vagina, all right. Trichomoniasis, that's trichomonas infection of the vagina. If there's some hormonal changes, all right. So okay, this one is like if the pH is going acidic, it indicates bacterial infections, trichomonas, hormonal changes. If it is going basic, indicates that if it is going acidic, way too much acidic, indicates yeast infection or pregnancy changes. So use this kit, use a swab, pH paper strips, color charts, just to interpret results. All right. So these are just the step. Hygiene. All right. Insert the swab into the vagina, gently rub it against the wall. Apply the swab to the pH paper. All right. Then compare the color change. You put this, right? So any color change, you compare it to any of these colors, so that I can get to determine, the effect of acidity or basicity.